All right. Good afternoon and good morning, everyone. Welcome to It's Worth a Shot for November 6th. Today we are having a guest speaker. Jessie Kinsey is joining us from Far America, and she is going to be talking about hypodermoclysis. Let's go ahead and go to the next slide. Just a quick disclaimer. As I mentioned, we are having a third-party presentation. So the information provided does not necessarily constitute endorsement or recommendation by Mountain Pacific. So let's go ahead and go to the next slide. We have a couple of updates and reminders for you. There is some updated guidance on both pneumonia and COVID-19 vaccines. The COVID vaccine, they've made a suggestion for a second dose of the 2024-2025 COVID vaccine for people 65 years and older, for people who are moderately or severely compromised, and for people who are moderately or severely immunocompromised. And then the recommendation for the pneumococcal vaccine, they lowered it from 65 years of age to 50 years. So we've included the links so you guys can take a look at that. Mountain Pacific recently released a opioid video discussing stigma. So it's a great video, quick learning. So make sure you guys take a look at that and share with your staff. We're also including some downloadable PDFs for immunization education. Some of those are holiday themed and kind of fun. So take a look at those. And let's go to the next slide. So it is American Diabetes Month, so we wanted to make sure that you guys were aware of that and you guys can do some recognition and celebrate American Diabetes Month. And this is just one of the fun flyers they have in recognition. So let's go ahead and go to the next slide. Make sure that you guys add your webinar topics, any ideas that you guys have to the chat, and then we will be sending out an evaluation at the end, and we appreciate your feedback. Let's go ahead and go to the next slide. So on the influenza snapshot, it's fairly stable across the country right now. There was just a small change in that below baseline there. And then let's go ahead and go to the next slide for the COVID snapshot. And again, we're kind of up and down, up and down. There was a small absolute change from the prior week. So again, pretty stable across the country. So let's go ahead and go to the next slide. So there was a question about some upcoming trainings for long-term care facilities. We've included the links in the slide deck here. There's one on November 19th and one on December 3rd, and these ones are going to be talking about the annual healthcare personnel. So make sure you guys tune into those. I also just sent out an email regarding a training that is tomorrow, and they are going to be talking about the nursing home reporting for respiratory viruses. And we will get that link in the chat for you guys right now. And again, take a look at your email so you guys can make sure you guys get tuned into that. And it is very early for our friends in Hawaii, but it's good information. They are going to cover all of the respiratory reporting after January 1st. So I know there's been a lot of questions about what will happen, and they're going to talk about it tomorrow. Let's go ahead and go to the next slide. We had another question regarding some flyers and infographics for hand hygiene between dirty and clean glove changes. And so Miranda went ahead and sent these out with the reminder for It's Worth a Shot today. And then we also have the links in our slide deck as well. So just some good infographics, things you guys can post. Let's go ahead and look at the next slide and you guys can actually see the pictures of what she shared. So there's the 5 moments for hand hygiene, and then gloves are not enough. So just some good reminders about changing gloves and different opportunities for hand hygiene. In addition to those links, she also shared the infection prevention risk assessment and the plan template in that email. So make sure you guys take a look at that. And without further ado, let's go ahead and go to the next slide, and we will turn it over to Jessie.
Thanks, Callie. Can everyone hear me okay?
Yes.
Perfect. Perfect. Well, thank you. Thanks for having me on, and thanks for everyone joining today. So I had a request to kind of do a little demo and discussion about hypodermoclysis, sub-Q hydration. And for some folks that may recognize me, that I work with them closely as they're servicing pharmacy, I know we did a little chat and demo. So we're just sharing the knowledge, especially as we go into flu season here. So next slide, please. So hypodermoclysis, I'll tell you guys kind of just a little bit of the fundamentals, the basics. I promise you, this is the easiest line you will ever start. And, almost anybody, you don't have to have IV proficiency, can start a line for sub-Q hydration. And really, the topic is timely. We're going into flu season and, maybe COVID, respiratory virus, or maybe just, bugs floating around as per norm, unfortunately. This is a really good way to hydrate our residents in-house, keep them in-house, try to rehydrate them versus sending them out to the ER. So again, super easy, and we'll kind of go over some fundamentals, and then I'm going to demo it for you to show you what it kind of should look like and how to place a line. So kind of fun. So hypodermoclysis, sub-Q hydration, for short-term fluid deficits, mild to moderate dehydration. Again, a great way to keep our residents in-house, in our homes, versus sending them out to the ER. And who can initiate? Really, most nurses, and I really have not encountered any regulatory barriers. If you have a competency in place, your policy and procedure, IV policy and procedure for us and most pharmacies, it spells it out pretty nicely. You can initiate it. Next slide, please. So what kind of fluids can we give? What are the considerations? So you can actually infuse quite a bit of volume at one time. And you can actually place 2 different sites and give up to something like 3,000 mils in a day. So quite a bit of hydration when you think about it when someone is dehydrated. Infuse at 2 different sites at the same time. You can run NS, LR, D5NS. It's really meant for isotonic type fluids. They need to contain electrolytes if you're going to use that type of therapy. If the infusion is electrolyte free or hypotonic, you should not be using those fluids. So that D5W, D10 are really not recommended for hypodermoclysis, and they can cause some serious circulatory overload. You would never want to give just D5 in water or D10, for example. But for general solutions that are appropriate for sub-Q hydration, again, NS, D5.25, D5.5, LR, all things that we probably have in our IV e-kits. Next slide, please. So not intended for, when we kind of look at hypodermoclysis, it's not for high volume fluid replacement. Again, just mild to moderate dehydration. It's not intended for residents with clotting disorders, maybe residents with some significant edema, or residents with other IV therapy needs. That's really not what sub-Q hydration hypodermoclysis is intended for. Next slide, please. So when we go to place a site, and again, I'll be going on camera here shortly and we'll do a little live demo for you. You really, when you're looking for your sites, you want to avoid a site that may be scarred, bruised, maybe an area where there's skin breakdown. The rule of thumb is to stay 2 to 3 inches away from the belly button. You want to stay away from an area that's prone to irritation, again, edema. Avoid those sites that might be infected, painful, maybe bony areas. Stay away from the breast, the waistline. So those are 101 sites to avoid. And if you go to next slide, I'm going to go over when we do again the demo, I'll tell you the sites that we should be looking for, which will be our fatty tissue areas and some more optimal areas for placement. But I wanted to lay kind of a baseline for what you need to gather to even place the line to. So we also need an order. What does that order need to look like? You should have the date, time, the solution, including the volume, that specifically this is going to be sub-Q as far as the route of administration. You want to include your rate. So what should the rate be? What do we typically run these types of sub-Q hydration interventions at? And really the optimal rate is going to be between 60 and 80. They say low side 60, 100 might be high, but most effective rate is going to be between 60 and 80. You want to specify in your order whether the hourly rate is going to be divided by one site or two. And that helps again for fluid, for supplies, and then it'll let the pharmacy know to, how to reconcile the order to send you the right amount of volume. And then include the duration and frequency of therapy. And most pharmacies, I think we have a template. I've seen some other templates floating around there that you can just populate and send over, and that can serve as your order for sub-Q hydration. And most of the time, again, we probably have IVE kits. A lot of you guys do. You can just pull those items from your IVE kit. You have your order on hand, and then you'll be good to go. So next slide, please. So what does that need to look like on the MAR? So just a few highlights. You want to make sure that you have orders on the MAR or your TAR to make sure you're monitoring every hour or as needed and really watching for redness, swelling, leaking of the fluid or discomfort. You'll include a dressing change rotation on there if there's site rotations. And then if you have any other in-house policies or procedures, this is not a line that's intended to stay in place very long. The sub-Q sites that or devices that we send out actually have a metal cannula. So the most you're ever going to see them in place is going to be 24 to 48 hours. That metal can be so irritating. You're not going to leave it longer. There's other devices that, the plastic cannulas, so you may leave it in 4, 5, 6 days. But what I'm getting at, I guess, is that's going to correlate to what your MAR is going to look like too for monitoring. And then also, response from the resident. You're going to get some baseline vitals, that kind of thing. And then your rate will be included on there. Okay, so just to highlight to make sure we have those assessments on our MAR-TAR when we're running this type of therapy. Okay, next slide, please. So what you'll need, this is kind of an image of the supplies, generic, super generic supply items that are out there that you may very well have in your IVE kit now. I encourage you, if you're not 100% certain if this is in your IVE kit, go take a peek. Reach out to your pharmacy representatives or your account managers, your pharmacists, whomever. You likely have something similar, and it's just a matter of orienting to the device. So on the screen here, the device type that is shown, this is a metal cannula, And again, that type of device is only going to stay in place about a day or two because that metal is going to likely cause irritation. And another thing that I like to highlight when we look at our supply, especially this sub-Q set, is this particular device, which is still out in our communities. I've seen it. There's no safety on the device itself. The safety is that tube that you see in the background with the blue lid. So the expectation from the manufacturer is when you discontinue this device, it's supposed to go back in the tube and then in your sharps. So kind of interesting on this one. The device type that I'm going to demo with shortly, I'll show you how its safety features enabled. There's also a Clio set that's out there. A lot of us have probably seen that for various settings. It's that purple push button sub-Q set. I think we used to use it a lot more than I see now. That device you would depress all the way and then the safety would engage. But again, moral of the story is just be familiar with your safety features so you don't poke yourself. But as we look at the items supply list that we may be obtaining from our e-kit, you're going to get your Dilaflow set, your manual administration set, just some clean gloves is fine. They do not have to be sterile. Some antimicrobial solution or chlorhexidine scrub, transparent dressing, normal saline because we need to prime the set before placing, and then of course our fluid that we order or solution. All right, next slide, please. All right, so I'm going to try to go on camera. And how I have there we go. Hopefully you guys can see me. There we go. So you may have to double click on my image to make the screen expand. I'm not sure how big I am on your screen. So what
Let
I want
me just step in for a second.
Yeah.
If that doesn't work, double clicking on her, you can go up to the top of the box that is the recording. You'll see on the right hand side there is a view button, and if you click on that and drop down, then you can actually extend it to side by side or exit full screen. There's a couple different options. And if you select the speaker view, then you'll see the slide deck and then Jesse. You might just see Jesse now, and then you'll have the larger picture.
I think I'm
Hopefully that works for
spotlighted.
everybody.
Yeah,
Okay.
I think Mary spotlighted me. Right on, right on. All right, so perfect. So what I want to show you guys is kind of a hands-on demo, and I want to go over these supply items and then show you how easy it is to place this sub-Q hydration and place the site and rehydrate your resident. It'll save you a trip to the ER. And again, I promise this is the easiest line you will ever have to place. So I went ahead and grabbed my fluid. Okay, so I have my fluid. You're gonna make sure you have a Dilaflow set. So your Dilaflow set is gonna be your, I feel like a famous YouTuber. Can you see this? So your Dilaflow set, that's gonna be your manual set. You can use a pump. There's no real one over the other. As far as requirement, you could technically use both, either a pump or a Dilaflow set. It doesn't matter, but if you have a Dilaflow set, that's perfect. It's fine. It's easy. So I have my Dilaflow set I pulled from my IVE kit. I'm gonna pull a couple flushes, saline flushes, because I need to flush this administration set prior to placement. Okay. I'm going to pull a needleless connector. So this needleless connector, the ones that we have floating around in our inventory right now. Oh, come out. Oh, it's stuck on my, let's see. The ones we have floating around in our inventory have those little green tops on them. There's going to be blue ones out there. There's clear ones, needleless connector. So pull that from your e-kit or your machine, your Cubex, your Omnicell, you know, whatever IVE kit you guys have. Pull one of those and I'll show you why you need it. And then I pulled my chlorhexidine scrub so that I can clean my site. So really, I have a handful of items the fluid, the administration set, antimicrobial solution to clean, and then I pulled some dressing, just some little Tegaderm to go over my site, and flushes, fluid. I think I have everything I need. So what I'm going to do when I go to my patient is I want to assess a location for my line placement that's going to be more of a fatty tissue. So subscapular, under the arms, right? Belly, as long as you're 2 to 3 inches away from the belly button. Maybe uh, s- um, lower back fat. So what you're looking for is a good area of subcu tissue where you can pinch up 1 to 2 inches of tissue. So what that's going to look like, again, subcu area under the arm, that's a really good location. That way when they're laying down, there's not too much pressure on it. We're going to confirm that site, and then I have all my supplies available. So what I'm going to do is have everything kind of ready, but I'm going to take out the our administration set first. That's going to be my actual sub-Q set. So for me, it says soft glide on it. It might say sub-Q set. It might say hypo set, but I have that set pulled out. And this is what I'm going to connect and flush first before placement. So I have my sub-Q set out here. And on this particular device type, this has little wings, and you have to take off the safety when you're ready to place it. So it's this white piece, slides down, and you spread the wings up and then pull the plastic piece off. Remember that some of these are, again, metal cannulas. They're not plastic, so you might have to take a plastic sheath off. I have heard a story of a nurse trying to place this and didn't realize to take the plastic cannula off first. I know, crazy, but legit happened. So understand your device. So what I have is my administration set. I have my flush. And what I'm going to do, of course, we've done our hand hygiene. I like the intro to today's presentation. Hand hygiene, gloves, right? So I'm going to go ahead and stick my needleless connector aseptically to the end of my flush and prime the flush, priming my flush. And then I'm going to connect this to my administration set and prime all the way through, okay? So this is ready. I'm not going to prime my fluid and my primary set quite yet. I'm going to go ahead, kind of get them popped, connected, and ready. But I'm not going to prime it, take everything off yet, just to reduce the risk of cross-contamination. So I'm going to have it semi-prepped, but I'm not going to have this all primed until that's placed, okay? So I found my my location on my patient, and I have just a little dolly that has a nice little sub-Q site here, okay? So we're going to use that for demonstration. So again, my butterfly, I take off that little white safety piece. You expand the wings on this type of device. Remove the plastic cannula. This line is fully primed. And you're going to pop up the wings on this. Pinch up 2 inches, 1 to 2 inches of fatty tissue. And this has been prepped and clean and air dried. And then 2 inches of fatty tissue. And then this just goes straight down. And then you place down the wings. Okay. And then you should pull back just a little bit. If you get blood return, you're in the wrong location. You should not get blood return. Okay. So I pulled back a little bit, no blood return. So go ahead and flush just a little bit. Make sure, everything looks okay. Then you can go ahead and put your Tegaderm dressing over the top. Okay, so this is up, ready, go. We have a good site. So then I'm going to go ahead and grab my hydration. I have my dial of flow manual set already hooked up. I'm going to go ahead and prime this the rest of the way through. Okay. And then once it's primed all the way through, I'm just going to disconnect from the needleless connector, connect my fluid. I have my hydration hung, and I'm going to go ahead and start at 60 and see how that site, that location tolerates that rate. Just that easy. So it's, again, I'm going to monitor it, make sure it's not leaking, that there's no pain or irritation at the site. And then, you know, if we're able to hydrate them, we can go ahead and DC it once our infusion is complete. And to DC it, super easy. So I have my site, I'm gonna pull that dressing off, and you're gonna just take those butterflies and go straight up and just assess your site. Make sure, you know, it looks okay, and then you can just clean it. There shouldn't, again, be any blood or anything like that, or you were in the wrong place. And then you should be okay. You might need to put a Band-Aid on it or a light dressing. And again, assess, you know your safety devices. So on this one, these butterflies, when you're done, they close and you grasp it together, and it's like Velcro. And then this would go in your sharps. So super easy. I just lost my screen, so hopefully you guys can still see me.
Yes, we can.
Okay. There we go. There we go. Any questions?
I'm not seeing any questions. Do you want us to bring back up your slides?
Yeah, go ahead. Perfect. So on this demo slide, again, just a reminder about the different devices that are out there. You can actually get an administration set that has one line, but 2 needles. So that's on the bottom left. That Clio set is on the upper left, that I was talking about, that purple device. And the image on the upper right is just where you pinch up the fatty tissue and you depress your site right in. We have skills checklists for nurses. We have a policy and procedure for utilization of sub-Q hydration. Just reach out to us. Most pharmacies do. We can hook you up, so no problem at all. So next slide, please. So in short, you can run up to 3,000 mils, so 3 liters of fluid sub-Q at 2 different sites. Again, there should be no blood return at your placement site, and you would just rotate that site every 24 to 48 hours, or when signs are, if there's any signs or symptoms of complication, you'd want to DC it. But if you're able to rehydrate that patient, then you would go ahead and DC it. So next slide, please. So just a quick recap again. Clean, remove your device. You're going to prime the device, clean your site, apply a dressing if you need to when you discontinue therapy, and then just dispose of your waste per your facility policy and procedure. So maybe a sharps container would be appropriate in this case. Okay, next slide, please. So easy, you guys. I promise. Make sure you have an order. This is a good way for slow rehydration. Keep your residents in-house. It can be used when you can't necessarily find good IV access. There's a low risk of fluid overload, can decrease your hospitalizations, and does not require proficiency to start an IV. So super easy. And next slide. So that's it. That's my live demo on sub-Q hydration. Any questions?
We're getting lots of very cools and love it in the chat. In case you,
Oh, good. I can't see my chat, so thanks for saying that.
yeah. Sounds
Yeah,
like there's a lot of great benefits.
there is. It's easy, you guys. I encourage everyone, go check out your IVE kits. If you're on a nursing home, in a nursing home joining us today, I'm 99% sure you have an IVE kit. Check out what supplies you have. As far as something that there we go, something we may start seeing on a regular basis, sub-Q hydration, hypodermoclysis is pretty old school. It's been around a long time. It's easy, it's inexpensive. And as we look at keeping our patients in-house, reducing those readmissions, it's just a resource that you could be using more.
And as far as policies and procedures go, would they just work with their pharmacy provider?
Yep. Yeah. If you guys are with the PharMerica, go ahead and just reach out to your local account managers. They can get you a copy of the policy, the nursing skills checklist. We can connect you with the resources. I think Omnicare, they have an IV policy and procedure book, very similar. The skills checklist is in there, and your P&P. And I think everyone in between, you probably have some resource with your pharmacy provider you can tap into, and don't be afraid to ask them. You bet. All right. Did I miss any questions?
Nope, I think that we have covered everything. I just want to thank you again, Jesse, for hopping on. I'm going to ask everyone, we put the link to the evaluation in the chat. So if you guys, I'm sure we'll drop it back in the chat again. If you guys will take a minute to fill out that evaluation. Again, thank you, Jesse, for joining us. And thank you everyone for joining us. We appreciate you guys hopping on. This is a wonderful training, and I hope that you guys can implement this in your practices. And then just as a reminder, It's Worth a Shot is taking a pause. So we will not have a It's Worth a Shot presentation next week, but continue to watch the listservs. We will keep you guys updated as more information becomes available. So thank you, everyone.
Thanks for having me. Thanks, everyone. Reach out anytime.